And Sarah, you even had your own issue with this, right? You were trying to get an anesthesiologist to be in charge of your anesthesia for surgery, and you ran into a lot of roadblocks.
Yes, I can tell you two surgeries that I had not that long ago. One, I should explain, I have a condition called pseudocholinesterase deficiency. I knew that I had it because I literally died when I was 7 and had to be brought back to life from a simple tonsillectomy. So that's how we found out that I had zero pseudocholinesterase in my system, which breaks down something called succinylcholine that they often give in anesthesia to help the muscles really relax. And so it's a thing that's commonly used. It used to be used more, is used less now, but is still used. So for every time I go into a hospital or in surgery, I have to say to them, I have a pseudocholinesterase deficiency. I need to have an anesthesiologist, not a CRNA, not somebody who is less trained, basically, because if there was a problem, if it was given by mistake, if anything happened, I will die. Pretty serious, you know. So my first surgery that I'm going to talk about was at a major hospital in Atlanta. And I said, I need to have an anesthesiologist. And they said, oh, you can't have that. We have the CRNAs run it. I said, but that's not okay by me. And I was told that Jimmy Carter had an anesthetist CRNA. And if it's good enough for him, it should be good enough for me. What had that got to do with my diagnosis or treatment? I don't know. Second time, I was having my rotator cuff surgery. And I went in the day of the surgery. I was there, waiting to get my operation, and a CRNA came in and talked to me, and I said, I have pseudocholinesterase deficiency. I want to make sure I have an anesthesiologist. And she said, well, that's not necessary. I said, well, I think it is, because pseudocholinesterase deficiency is very serious. And she said, well, we give succinylcholine anyway, even if you have deficiency. Yeah. And most people who say they have it don't really have it anyway. And I said, I have an absolute deficiency, which means 0 in my system. And it is a genetic thing. It's in my family. And I would like an anesthesiologist. And she said, well, it won't be a problem, because even if you were going into arrest, the hospital, this was an outpatient surgical center. The hospital is right across the road. This is word for word. And we could get you there. You mean when I'm dead, you're going to transport me to the hospital and they're going to revive me then? So I said, well, thanks for your information, but I'm leaving, because if I can't get an anesthesiologist, I'm not going to put my life in danger like that. So I started to get dressed, and I was coming out, and the surgeon happened to be there. And I said, and he's like, what's happening? And I explained to him what happened. He said, oh my God, no. He said, I'm so sorry. The anesthesiologist will absolutely look after you, and I will talk to that person. But if I hadn't known, if I hadn't had the understanding for myself, this person was so cavalier that they would put me under anesthesia with succinylcholine and not be worried about it. And I may not be talking to you now.
And, it's interesting because they call doctors arrogant. And you hear stories like this and you think, this is not acceptable really from anyone, this type of cavalier attitude. You're supposed to be undergoing informed consent for procedures, which means you need to understand the risks, the benefits, the alternatives before you can even agree to undergo surgery. So to be so cavalier like that, it just flies in the face of what is just a typical expectation when you're having a procedure.
And this has become more and more and more.
If you'd like to learn more, I encourage you to get the book, Patients at Risk, and the follow-up, Imposter Doctors. And if you're a physician and you'd like to learn more about getting involved, join our group. It's called Physicians for Patient Protection. Our website is physiciansforpatientprotection.org.